This is my mom, Lori. She was first diagnosed with breast cancer in 1995 when she was 36. She went through periods of treatment and remission throughout my childhood. Even when she wasn't dealing with the nausea and fatigue that come with chemo, she lived with weakness in one of her arms because of a mastectomy. My mom wanted to be as independent as possible, but she knew that for some things she needed a hand. When I was little, I would sometimes see my parents vacuuming the stairs of our house together. My dad would carry the heavy part of the vacuum behind my mom, who would use the hose to suck up the dust and the dirt. My dad would have gladly taken over the vacuuming, but she insisted that they do it together. In 2003, during the first week of my freshman year of high school, my mom passed away. 5 years later, I was studying nursing at the University of Delaware. On the way to class one day, I was talking on the phone with my mom's sister, Linda. I told her that I was meeting all of these new people at college, and I was frustrated that their main introduction to my mom was just learning that she had died. I wanted a better reason to say her name, Lori, out loud every day. My mom had always helped people through these quiet shows of support, not through grand gestures. And I realized aloud to my aunt there were probably people living all around campus who could use help carrying a bag of groceries or lifting a heavy vacuum, things that seem simple unless you're living with limitations. The idea for Lori's Hands, named in memory of my mom, was born that day. Classmates and I founded the organization as a club on campus that spring and began making weekly visits to the homes of community members living with chronic illness. We'd organize closets, hang Christmas lights, or prepare meals. Today, students make those weekly visits to the homes of more than 140 community members living with illnesses like cancer, Parkinson's, MS, and heart failure. We're also transforming healthcare education, giving students the opportunity to learn about health not just from a textbook, not just in a clinical setting, but also in the community where most of our health really happens. Last fall, we launched our second Lori's Hands chapter in Baltimore. We're planning a third in Detroit, and we envision chapters all across the country. Every time a student pulls up to a client's home carrying a bag of groceries or eager to get to work in the garden, and I see my mom's name written across the front of their green t-shirt, I have the opportunity not just to recognize my family's loss, but also to honor how much can be gained in my mom's memory.